Hello, everyone, and welcome to Ask Muniza and Dr. Phan. Your questions on chronic and autoimmune illness. We are so super stoked to be here to serve you all today. Welcome, Dr. Phan. As always, it's a pleasure to have you on the show.
Hello, good to be here.
All right, so I know we haven't sort of slated a topic for this show, but I thought we could start with talking about um, a very common sort of women's health issues, which is, hormone replacement therapy. And as women head into menopause, this conversation becomes more prevalent. Do I need hormones? Do I need to have like estrogen and progesterone? So what do you think is the deal with that? What are your views on hormone replacement therapy?
So, what I would say is I used to be like the Oprah Winfrey of thyroid and bioidentical hormone replacement in my journey to learn about, healing alternatively, right? So I was like handing out thyroid hormones, bioidentical hormone replacement therapy for women, like Oprah Winfrey. Just, you get it, you get it, you get it, and you'll hear that a lot from nowadays doctors who are really trying to kind of move over into that realm of women's health, because let's say you're an OB-GYN doctor and you're 70, 60 years old, you're tired of catching babies at 2 a.m. in the morning. You know what's easier?
Yeah.
Hormones. It's more lucrative. There's less of liability in terms of delivery of babies that may or may not go wrong. And so it's much more comfortable for that doctor, because every 4 months you come in for a pellet. I give you this, you give me cash, and we're both happy. And then you can enjoy and have less hot flashes and have sex with your husband 5 times a day. And in reality, it doesn't work out that way. Every time you're introducing hormones in the system, you're changing the dynamic of your body a little bit. In particular, giving hormones, even if it's bioidentical, to potential things that feed on it, right? Whether you do
Right.
have a brewing tumor or cyst or something like this, you've got fibrocystic breast change.
Right.
We know that oral contraceptives will cause weight gain in some women. So they're billed as, hey, these hormones will help you feel great and do everything else, and they don't always do that way, and you have to get the right dose. But once you put a pellet in, you can't take it out. You have to kind of go through that 4 months and then kind of even out, and the next one they adjust and things like this. So you're kind of zeroing on the dose.
Yeah.
But even if you're doing bioidentical hormone replacement, remember, I mean, Isa, you tell me this, is that your own hormones will not feed pathogens.
Right.
But if you're adding a lot more, with the exception of adrenaline and cortisol, I'll say that, right? But I'm talking about the sex hormones like estrogen and
Yeah.
testosterone things. We are inundated with.
Estrogen, progesterone. Yeah. I mean, so our own hormones do not make us sick, right? I think in the professions out there in the industries, both allopathic medicine and alternative medicine, there's an idea that women's health is women's fault. And a lot of that blame comes onto our own bodies vis-a-vis our hormones. So even if we skip menopause and go further back, young women, teenage girls are being offered, when they have cramps, they're being offered birth control, also hormones, right? Um,
Mhm.
they're being offered, if you have a heavy period, you get a birth control pill. If you have heavy cramps, you get a birth control pill. If you have any menstrual problem, you get a birth control pill.
Yeah.
And I don't know, have you watched that documentary by Ricky Lake, where she did the business of
Oh
birth?
yeah. I haven't watched that one yet. I remember I've heard of that one. Yeah.
There are so many hard-hitting scientific data points in that documentary about the dangers of the birth control pill. So I'm thinking, okay, so you might know this better because I've never taken a birth control pill. What's in a birth control pill? What kind of hormone is it?
Well, it is. It's kind of like an analog of your own hormones, right? So they call them different types of progesterone. And really, in reality, it's a kind of a compounded synthetic one. It's not
Right,
a bioidentical. But even if it's not bioidentical, you know, how do you know it's 100% the exact same thing that your body produces in the ratio and the delivery system, right? Because it's
right,
being delivered through a pill, and that's not how in nature that we're not like, oh, this stork delivered this hormone to me and I'm taking a pill. No, it's your own, organs secreting a dose in response to other things in the system.
right.
so many variables. We think we know a lot. Science thinks it knows how the system works. We don't know anything. We don't know anything. We just like we're guessing, you know. So yeah, you can get even not to mention our bioidentical hormones or xenoestrogens. Basic xeno means alien or outside
It's
stuff.
foreign, right? It means like
Foreign.
foreign, yeah.
Yeah.
So
So
xenoestrogens actually are not made in our body. They're foreign in that they come from plastics or what are really poisonous, toxic substances in our home. Shower
mhm.
curtains are a big source of this. Or, heating food in plastic containers in microwaves are a big source of xenoestrogens coming into our body. So, yeah, so you were saying with xenoestrogens, they are the ones that cause the problems, right?
Yeah, they can they can feed the burden, the pathogens and stuff like this, basically. You know,
Right.
so you got xenoestrogens that you don't even know. I mean, they're finding microplastics everywhere in men and fertility issues and kids and everywhere. It's just inundated our body. And then then you're adding these other hormones, high powered hormones that, I mean, is there binder or filler that's corn and heavy metals and coloring and all these different things. So you have this perfect setup for something to happen. But why do they work? Because some people are like, I don't care about that. I just want to like get relief from the pain or whatever it is. I mean, when you put a hormone, which acts like a steroid, you're going to feel better. If you take prednisone for something, you're going to have decrease of swelling in terms of the joint or whatever. So you're going to feel better, and you'll have that. But at the same time, are you feeding something down the line, right? I mean,
Yeah.
5 years, 10 years down the line, are you going to have these Women's Health Initiative about hormones and all these conflicting studies? It's sometimes hard to figure out which it is. But if we're going from a perspective of medical medium, we know that these foreign hormones can feed pathogens. Not to mention our own cortisol, adrenaline, our own
Right.
cortisol, adrenaline that could you can burn. You can basically burn out the pancreas. You can the used up toxic adrenaline and cortisol have to go somewhere, and your liver is going to take that burden, and then you're going to gain weight. And you're like, well, I wasn't this way before when I had hormones. You know, so there's
So
a lot.
coming
Yeah.
back to just to come back, we did say at the beginning that your own hormones don't actually make you sick, but I just want to point out when we talk about adrenaline, the reason we specifically mention adrenaline, and one might think, oh my gosh, my own adrenaline can make me sick. It's only because viruses have been genetically modified and engineered in order to eat your own adrenaline. So it's not designed by God to make you sick. It's been usurped in a way
Yeah.
to use against our body. So we have some interesting comments coming up in the question box. And if you're watching, please write us a comment, ask us a question. For our first comment comes from Carolina in Costa Rica, and she says, I'd love to announce that a medical medium baby is on the way. I'm pregnant. Many, many, many congratulations, Carolina. I know this has been a dream of yours for
Yeah.
I am so happy for you. That's amazing. And my question is, how do you deal with severe pregnancy constipation? So I'll take that one. I can start and you can jump on as well, Dr. Phan. I like to focus on aloe and magnesium, which are very much needed in pregnancy. I think we can actually become deficient in magnesium as pregnancy progresses. So I don't know how far along you are. If you're announcing, you might just have crossed the first trimester. Maybe you're in your second trimester, Carolina. So severe constipation is often dealt with aloe. And you can do more aloe than just, a couple of inches or what have you. Definitely bring in magnesium, and then lots and lots of hydration can be helpful. And these are the basics for dealing with constipation. The other piece can be swelling or inflammation in the intestinal regions or the colon, where the swelling of the tubes reduces the space inside, and it can cause a level of slowing down of the bowels, or you could have a overgrowth of strep in the colon area, which can also cause a problem. So for moving the bowels, Anthony actually says that cherry juice is better than prunes. It's really helpful. So a combination of aloe, papaya, cherry juice, or cherries can be helpful for getting those bowels moving. What do you say to that, Dr. Phan?
Yeah, definitely. Papaya, if you got some. Um, From a medical standpoint, I mean, you can always do a water enema if that's the case, right?
Yeah. Yeah.
Um, if you're a mathematician, the joke goes, how did the mathematician solve his problem? And the answer is he worked it out with a pencil.
Right.
But you probably don't want to do that. I would probably use suppository if that's the case, if it's really bad.
Yeah. Um, so I think that, try some of these tools. She said she's 5 weeks along. I'm really going to pray that, everything goes smoothly for you. Carolina, that's really good news. All right. So our Mia says birth control pills seem to cause breast cancer. Yeah, they are implicated, right? There's an implication there. I think even studies show that even in the side effects, they write about that. And coming back to birth control pills, Dr. Phan, I want to address this because progestin, which is the synthetic form of progesterone,
Yeah.
is used in both birth control pills to suppress a cycle and in hormone replacement therapy as well, right? So what's really the difference chemically between birth control and hormone HRT? So birth control typically you're given when you become sexually active to prevent a pregnancy. But then HRT is on the other end where you're beginning to sort of go into menopause, perimenopause, and you're given that to, kind of mitigate the impact of whatever happens during that time of a woman's life.
Yeah, so they use progesterone to decrease the likelihood of estrogen promoting growth and stuff like this, right? It mitigates that risk factor. I mean, so progesterone is different than progesterone, and I think Anthony's website does recommend wild yam progesterone, so that's okay if it's typically milder to the skin. It's not going to go to the liver. When you're taking some of these bioidenticals, some of them are administered via mouth, which has to go through the liver eventually, and there's where there's a lot of things that happen there. And progesterone orally makes you sleepy, so that people who don't sleep because of menopause symptoms, they give progesterone at night. A lot of progesterones that are commercially available have peanut oil in them. Prometrium is one of the brand names. And if you've got an issue with peanuts, that's good. But again, they still go, even though it's bioidentical, it still goes to the liver. And so what happens in the liver? Viruses have a heyday sometimes having more of these binders, fillers, and hormones in their system. So you just have to weigh the consequences of that. But a lot of doctors, OB doctors, will say, look, don't worry about progesterone. You don't have a uterus. You're gonna be fine. You're not gonna get cervical cancer or uterine ovarian cancer if you've had a hysterectomy. What they fail to realize is that you still have breast. Women still have breasts that can respond to the hormones too. And so if you got growth there, will they get enhanced or not? There's going to be a lot of literature that kind of like says, no, you're fine, you're fine. There's always something like this. There's always going to say, there's this warning, there's this problem, and then some other organization comes out with opinion, or it's like, no, they didn't do the study right, and so don't worry about it. Just we'll keep on, promoting whatever XYZ hormonal therapy.
Yeah. So I think that there's a crossover between the hormones that are in birth control and the hormones that are for HRT. There might be different degrees or different proportions of estrogen and progestin in those pills, but they're just a combination of those things. And do you think that it's safe to say that HRT has the same negative implications that birth control has?
Yeah, I mean, I think it's probably cleaner, but again, in the way that it's delivered, and can you really replicate? Honestly, humans don't know how many types of estrogens we have in the body and the right ratios. We
Yeah.
have estradiol, estriol, and estrone that they typically use. And then the precursors like the DHES and pregnenolone and these things. But we just throw it in the mix, hoping that throwing it in there is gonna kind of like the pyramid, the champagne pyramid. We hope to throw a bunch, kind of trickle down and it'll work itself out. If you're good, you're great. But if you're unlucky, and you may not do so well.
Right. So our next question is from Susie. She says, how important is a mammogram if you have normal appointments and never had an issue, but I'm now age 48? Do I need to do it at least once?
Well, that's a tough answer. That's a tough question because the conventional doctors will say it'd be bad not to do it. It's malpractice, whatever, if you don't ever do it. Depending on what organization you ask, like the American College of Obstetrics and Gynecology, they'll say every year. Radiologist groups say every year, whereas the United States Preventive Task Force Service reduced it to every 2 years because they realize that women who have abnormal breasts, like fibrocystic change or what they call it, fibroadenomas, um, they'll have some abnormalities, and then they'll have the whole gamut of tests. They'll do the mammogram, and then an ultrasound, and then they'll do a biopsy. And if the biopsy is negative, so we'll see you next year. Come and do it again. And it's like, what? You put this person through all this stress because number one, you can call and you tell them you have an abnormal mammogram, and already that throws people into kind of a little bit of stress state. And you're waiting for these procedures, and then they do an ultrasound. You're waiting for that result. So it's not happening in 1 or 2 days. It's easy to say this, to say this is what should be done, but when you're the person who's actually doing these things, it's pretty stressful. And so that's
Yeah.
why these organizations said let's reduce that a little bit. From the medical media standpoint, what you're worried about is cancers or tumors. That's Epstein-Barr virus, right? And we're not here to tell you what your doctor is going to tell you, but you need to consult with your doctor about this and give them kind of. Most doctors will say, no, don't worry about it, you'll be fine. But you're irradiating your breast, and you just have to consider that, right? Again, I have to say you have to listen to your doctor and go with what the doctor recommends, because otherwise it'll be providing, um, again, standard of care. But there's a push pull here that you have to realize, and you have to go with what you feel is right for you and what your doctor recommends, taking into account what your doctor recommends.
Yeah. Yeah. I would also say that perhaps as a first step, you could do a thermogram and use that. It's often not covered by insurance, and it's often not recommended by your doctor, your main doctor, because doctors believe that thermograms don't give you the full information that you would get from a mammogram. Alternative doctors, naturopaths, and chiropractors and people of that nature will say that a thermogram is a good first step. If your thermogram indicates so, you may then make a decision to do a mammogram. But if your thermogram is clear and there's so here's the thing with the thermogram. Thermogram, as the name suggests, picks up heat in the body. So typically, if you had a problem in the breasts, like a sinister problem, like, the C word or what have you, then it may pick up more heat in the breast. But it will pick up, there are hot spots all over the body. So like the liver tends to be a hot spot. If you have a, warm liver or hot liver, it could pick that up as being a hot spot. Now there's normal hot spots in the body, and there's ones that are less, places that are cooler typically. So like your head could become a hot spot. People's brains do get hot, as we know. So sometimes hands are cooler, but the inner parts of the body can indicate different areas of heat. Now, here's how it typically goes. I've had clients who found a lump, right? And then the first thing that they do is they go get a thermogram. If the thermogram matches a heat point at the point of the lump, then the doctors and everybody recommends you've definitely got to do a mammogram, because at this point, for doctors to diagnose the problem, you have to do their test. They will not diagnose it from a thermogram. Now, you could find a lump or a cyst or something, and you could do a thermogram, and you may not have a hot spot in the breast, in which case your doctor will probably say still, to be sure, I would have to do a biopsy or I have to do a mammogram. But an alternative doctor or a functional doctor might say, since there's not a heat spot, then you could be okay to wait. And let's see, keep testing with a thermogram. If it becomes a problem, then we take that next step. So there are different approaches, right, Dr. Phan? You can, and whether you do a mammogram or not, I think I'm not a fan of routine testing. I think that if you want to test something routinely, then it should be really, really safe. And what do you think of that approach? Do you think that that's
Yeah, I think it's a reasonable approach. Keep in mind that a thermogram is not recognized by any of these major conventional organizations. There's usually two involved. It's out of pocket, probably around $200 each. So you do one thermogram, and then you follow up with a 3 to 6 months one to see if there's any changes. But another alternative that's more conventional is an ultrasound. Ultrasounds are hardly ever given by themselves. You usually have to get the mammogram first to do it. But if you decide to pay for it yourself, you can actually get an ultrasound by itself. So remember, ultrasound is the backup after a mammogram too. So it's sometimes more sensitive to finding some things. But you could pay for an ultrasound if you find a place. I think HerCare and the different ones, but you need to have that probably out of pocket. But most radiology groups will never do an ultrasound without a mammogram first.
Yeah.
I found some exceptions, but it's difficult.
Right. So like a thermogram, ultrasound is a good combination at first, maybe if people want to take that route. And then if you have to do a mammogram, then by all means, if it's needed and it's warranted, then you can take that next step. But it's always a good idea to go from less invasive to more invasive, right? You don't even have to do the middle step first. You could do something less invasive, having less radiation first, and then take those next steps. So I hope that answers your question, Susie. All right, our next good question is from Seaweed Hero. Nice to see you here, Seaweed Hero. It's been a while. Copper IUD is better than birth control pills, better than the injections. What do you say?
I say no. I mean, we don't. I mean, Anthony talked about yesterday. He doesn't like copper, right? And then, of course, you hear these horror stories about the IUDs being like stuck in some place and scarred over, and taking it out's even a big issue. So you don't want to be giving copper to your body. I mean, it's kind of like, what's better, cyanide or arsenic? Which one's worse? Like none, please. Better than injections. It depends on who you are and what your risk factors are. If you're someone who doesn't care about Anthony William, you decide with your doctor. If you're a medical medium person, then you kind of want to stay away from both. I mean, there's the whole cervical mucus method, but that's something we need to know more about. You're still taking a chance, obviously, but yeah, you may have to think about some other alternative ways to prevent a pregnancy if is that what your goal is. Seaweed Hero, I don't know how long you've had a copper IUD, but I mean, now if you've got one, then I don't think you do. But you do the best you can and maybe get it out if you can.
So yeah, so Seaweed Hero, copper IUD is not better than a birth control pill. It has resulted in women that I've worked with having major issues in the uterine reproductive region. I've had women have their eczema completely go away as soon as their copper IUD was taken out, because remember, it's a contributor to eczema and psoriasis, as well as mercury. But sometimes if you actually have copper in the body, it can cause that much of an issue. And also you can have, if you have endometriosis or you have like a condition of growth that's in the uterus and you have an IUD in there, it can actually pack around the IUD, making it very difficult to take it out. So IUDs are my least favorite recommendation for women. I mean, they rank to me the same as birth control pill and injections of any kind. I think this idea that we can mess with the God-given reproductive system to manipulate it, to make it work to our favor, to, prevent pregnancies, cancel pregnancies, all of those things, it's tricky. It's a tricky area because it always comes with a lot of fallout, a lot of collateral damage, because our bodies are not, you're working against the nature of the body. So I think that that's a really good point, and I'd love to sort of have this ongoing conversation in the community around, what women, and educate both men and women on what is appropriate for women to, engage in sexual activity or to be able to prevent a pregnancy or things of that nature. There's ways to do it that's least invasive for women's bodies. I think many women's bodies, women are expected to take the brunt of the hit when they choose those kinds of options. All right. So
bottom line, IUD is like an IED for some people.
Yeah. Yeah. Then he's asking as a follow-up, I do not have one, meaning a uterus, I think. I'm a man, which brings up condoms are better than male birth control pills. Vasectomies are best. Again, I'm not a fan of messing with the reproductive system. So if people don't talk about the side effects of vasectomies. They think it's like, oh, you just tie up those tubes or snip those tubes and you're good. Male hormones are not as discussed. They're not as commonly discussed. They're not talked about. But I do think that it would have a significant impact on a man to have his tubes tied. What do you say, Dr. Phan? I'm not a man, so I don't know, but
Urologists will sell it as an easy thing to do. Clip, clip, you're done. They're not always fail safe. Obviously, many people have gotten pregnant despite vasectomies. I remember, and this is just a story, I can't draw conclusions from this, but I was rotating with a primary doctor who used to be a urology type person in family practice, I guess. I can't remember exactly what. But he would do these experiments in research papers where he would actually do vasectomies. And what he found was there was increased rate of fertility, testosterone production decreased because of somehow tying the difference, whatever it is. So I don't know. I don't think I've read any studies about that, but this was his own personal experience where he thought that the testosterone dropped after doing vasectomy. So I can't. I never signed papers. He just was telling me anecdotally. So there might be something there. Having said that, yeah, what happens when you tie something up and the flow is not right? I don't know, right? I'm sure there are infections for sure. We've seen that. No problems. Those are just going to come with anything. But what happens there? I mean, if you had to choose the lesser evil, maybe condoms would be it because it's easier to do. It's you're not internalizing anything per se. But again, you got to think about what is your outcome, what's your goal, and stuff like this.
Yeah, agreed. It's what's the goal? What's the, also I hear from a lot of men, or I hear from women who are married to men who have male partners, that men don't like to wear a condom. They just don't want to deal with it. They don't want to deal with it in the moment. They don't want to, finagle with it. It doesn't feel as good intimately. And so vasectomy tends to be the thing they do, or they want women to get their tubes tied, right? Like to avoid this issue. So I think that my response to this is everybody should learn how to track a woman's cycle, to know when she's fertile and know when she's not. And really, a woman is only fertile 3 to 5 days of 30 days or 28 days of the month. And the rest of the days you can have unprotected sex without a condom when she's not fertile. If she's not got fertile mucus, non-fertile mucus means you cannot get pregnant. You can only get pregnant when you have fertile mucus, but it's a way of understanding the body that is so much more in depth, so much more in tune with the natural cycles of women. And if you know that, then you can very confidently choose intimate relation times, like when is a good time, and then you avoid those days where you are it's not just that you are ovulating. You have to look for the presence of fertile mucus. So Seaweed Hero, maybe that's more than you want to know, but I know many people here are listening and asking those questions, so I wanted to address that as fully as possible. So would love to address this other question here from Kaylin. Kaylin says, I was in the back to school masterclass. It was amazing. Thanks for being there, Kaylin. I was asking about my son who may possibly have viral narcolepsy. And I was asking about melatonin, but realized, and her question continues, that he shouldn't be taking that. What supplements should I start giving besides the Core 7? Any extra? Should I not give him melatonin? So in the Brain Saver book, Medical Medium writes about 2 causes of narcolepsy. One is viral, one is toxic heavy metal based. So your son could possibly have both. And my opinion on the melatonin is that melatonin is not just for sleep, right? So narcolepsy, for those of you who don't know, it's a condition where you can fall asleep at random times of the day because the sleep centers of the brain are saturated with poisons that have a hard time regulating when you should sleep or when you shouldn't. So melatonin, actually, Kaylin, also it reduces swelling and inflammation in nerve cells of the brain and nerves near the brain. So it's really great at reducing cranial nerve inflammation, for example. So if a child has narcolepsy, if you give them melatonin at night, I think that's totally fine to do, and I would encourage it. Dr. Phan, what would you say?
Yeah, melatonin is a really good antioxidant, and there are people. I mean, you're gonna hear this crap on the internet. It's like, oh, you're gonna get dependent on melatonin, or da da da. It's affecting it. I mean, in higher doses, actually, melatonin is really good for in the cancer protocols Anthony has out there. But yes, if you're getting a melatonin that has like berry flavor, or don't do it. Right, get a clean one. Obviously, beverage is the one that's preferred, but even in pure encapsulations, you can use that. But melatonin is actually one of the supplements that is recommended by pediatricians for autism, let's say. But
Yeah.
melatonin is a very high antioxidant. It's actually good for the kidneys from studies about that. So there's the whole idea of you getting dependent on, I think it's good to bring it in. But if it's too if he's too drowsy and you go slow, you have to go slow because you may be introducing it too fast.
Yeah, just go slow. And after a while, the body just sort of gets used to, not addicted, but just used to that level of melatonin. So it shouldn't be contributing to him sleeping during the day. Just remember, what's doing that is the metals and the viruses that are causing that. So you said what other than the core 7, I would focus on a cranial nerve inflammation protocol for him. Really bring that in. That would help. All right. So our next question is, what would you recommend for syringomyelie? Any additional protocols to the MS protocol? Is the root cause only viruses or also toxic heavy metals? What are your thoughts, Dr. Phan?
Yeah, I mean, whenever there's a abnormality in the structures, there's metals involved typically, and of course the viruses augment those toxins and metals in the body. So yeah, definitely heavy metals need to be out. But I mean, I think the protocols for MS cover heavy metals too. I mean, account for metals in the system as well. So I think I lost Muniz. So that's the simple question basically. So let's take a look here. I'm going to try to answer some questions that or that I can see at least. There's a bunch of them here. Jacob, I hear you saying that you had worsening your CFS after trying some bentonite clay, and then that you're detoxing too much. But it's hard for me to know what are your symptoms. I think that you're not necessarily detoxing from the heavy metal stuff. I think it's related to you're having side effects from the bentonite clay, and has that riled up things. We don't know if the bentonite clay is actually absorbed. When you're taking bentonite clay, any of these binders that you're talking about, zeolite, bentonite clay, no, you're not absorbing the good stuff you put in your body. Your bentonite clay and zeolite, they can't determine like, oh, this is good, I'll absorb this one, or I'll suck up this one, I'll absorb this. It's all there, and that's the problem. That's what Anthony said. Like, you don't want to avoid those things, but you don't really know if now you're having issues with whatever was in that bentonite clay. We don't really know what's in it. So rather than saying it's the heavy metal detoxing you too fast, you might have had a flare actually by now.
Yeah, exactly. So I think that makes a huge difference. Mia says, Maniza, your fertility summit touched on the mucus and fertility really well. I learned a lot from it. I think many people are responding to the fertile mucus conversation. Yeah, it's a really big deal. It's like the best way with no invasion whatsoever needed, except the kind you want. So,
Yeah, stop me. I'm going to say something stupid. So, okay, yeah, gotcha.
Well, we got to crack the jokes. I mean, we're talking about sex. We're talking about,
yes.
Come on, we can have some innuendo here. What's the fun in that otherwise?
That's right.
All right. So I had to say it, Dr. Van. I couldn't resist. So all right. So our next question is so many questions have popped up. I just can't keep up with them. So I'm going through them, trying to find trying to find a good question. So we have another question. I think this is a really good question to address in the community, which I think will speak to a broader to a broader audience and to just a broader discussion. Do you know anyone following medical medium information and also eating animal protein, lots of animal protein, like water-packed salmon or sardines, grass-fed beef, any on social media? I have noticed none. Dr. Phan, I know you have a lot to say about this topic.
I do. Uh,
Yeah.
no, I mean there are plenty of people who do that. They're trying to do both worlds. I mean, I'm not. I don't, but I certainly think you can. I mean, there's people who can get away with it. They don't have any problems, so they can eat cleaner and still eat some animal protein and still feel good. I would say the majority of those are guys. But the reason why people turn to animal products is because they're not supplementing themselves enough calories, right?
Yeah.
So if you're not getting your calories, you're going to adrenalize yourself, or you feel bad after how many months it is that you're on this medical medium. Initially, you start, you're like, oh, I feel great, and then you just your hair starts to fall out in clumps because you're not getting enough calories because your adrenals are running, and then you can go turn back to eggs and dairy or whatever high protein thing. So yeah, I haven't on social media. I don't know. I mean, I'm sure there are a bunch of husbands out there eating all the animal protein and doing celery juice and lemon water. But you can do it.
Yeah. I mean, the first thing I want to say is that I've worked with thousands and thousands and thousands of people, and I would say 90% of them are not on social media. So they're just not. People ask me
Yeah,
for cases all the time. Like, do you know someone who healed this? Can I find them on I think the first place we look is social media, but actually that's not where most people want to share their health information. They just keep it super private.
yeah,
A few people share, and it's often the same people over and over again who share, but it's limited. The amount of health information from people that gets shared on socials, even in the community, is limited. So that's the first thing I want to say. And you're asking about, I just met somebody the other day who's an amazing woman. She's part of our community, been healed some pretty severe symptoms, eats a fair amount of animal protein, was noticing that in 3 years, she's healed some pretty severe symptoms while eating animal protein. And I think you can get away with that when you're not that sick. When your liver is not that compromised, you can get away with eating more animal protein. And then we were talking because she was feeling like she had got a bit stuck. So my first suggestion was not to cut it out, but to lower it a little bit. Maybe if you lowered it, instead of eating it 7 days a week, you could eat it maybe 5 days a week or 4 days.
got a little bit of delay there. Let's see if she comes back on. Nope, I'm back there. Well, when she comes back in, maybe she'll go to the other side. She'll switch things around a little bit. So yeah, I think to go with her point is basically you can reduce that and you can still heal if you're not very sick. Those who are more sick, who need to detox more, because remember fat, which is in all animal products, they need to get the fat out, and it's not easy. I mean, many of our practitioners can't get rid of fat because of the whole calorie kind of thing. Um, so yes, we picked up there. Uh, we keep on getting interrupted because of connection.
Okay, I'm back.
Okay, so we'll keep on going a little bit until she can get him on. I'm going to address this other question. I think Andrea had a question, and whoever's writing for Andrea is about testosterone, other than with foods. I mean, I don't think grounding and sunlight are going to be the issue. I think Anthony's talked about grounding in his Instagrams. Um, but I would say for testosterone, are you having ashwagandha, right? Are you eating pumpkin seeds that have a lot of good precursors for testosterone? And even too much animal protein, goes on with animal protein, can actually reduce your testosterone levels. There are studies that kind of support this, and of course, they're refuted by the carnivore community. But Anthony, I think, has hinted that basically too much animal protein will destroy man's testosterone. Whether you believe that or not, you don't have to. But you could try some things like ashwagandha and even some of those things in the Cleanse to Heal book under the Loss of Libido fertility section to support your testosterone levels. Okay. We're still having technical difficulties. I'm going to go in a little bit if Muniz doesn't come on. Let's see if else I can figure anything else on. I think she's having a lot of trouble. Um, mm, Constant congestion in the sinuses, really strep. You got to work on the strep. Um, if you would do the even the adding the mold exposure shots is very helpful. Turmeric and ginger shots is helpful. If you're doing golden seal already, you can even add golden seal or silver to a nasal rinse as a way to help that out a little bit. So think about that. Do, 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 do. Okay. So cravings you're having, you may want to consider some of those shots, the brain shots. There is a, I'm blanking now, but there's a, there's one for specifically for cravings and stuff like this. Somebody mention it, please, on that thing, because I'm blanking at this point as far as um, the brain shots for food cravings and stuff like this. Um, hmm. Okay, how much does sex once a week as a male affect healing? Kill adrenals so too much, 1 time a month better. It depends on you. I mean, it depends on your adrenals basically too. If you notice that, definitely if you notice that, wow, I'm having these drawbacks. There are clients of Moniza's who have sex every single day, and she's like, look, guys, you're pushing adrenals too much. And it's hard. There's an addiction thing that you go on. You feel better in the moment or whatever, but you're actually pushing your adrenals. So if you're young, you can probably handle it. If you're not and you're feeling it, I would back off and see. There was a post. Or sorry, Anthony talked about this study that they said science says you need to ejaculate 21 times a month in order to prevent or lower your risk for prostate cancer, and that's just ridiculous. I mean, I don't know how they came up with that number and testing, how reliable that testing is. You could probably look into it and see, but I would say that great if you can handle it times a month. That's great, but you may not want to do that if you're worried about other health issues and stuff like this. Um, Arlene Chiblains, again, I think it's the same thing as Raynaud's. It's just a different form of Raynaud's syndrome where the Epstein-Barr toxins are really affecting the blood vessels in terms of the receptors to kind of vasoconstrict and vasodilate the blood flow into the area. Um, so we're gonna have to probably end soon. Let me take this call. I think Maniza's trying to connect, but she can't. Hello, Maniza. Yeah, you may end. I'll end the broadcasting. Yeah, computer froze, and so I'll go ahead and end this broadcast, and we'll pick up some other time. Okay, I got to get to the next patient in a little bit. Thanks. Bye. So that was Manita, and she's trying to connect desperately, but there's something wrong. There's just something desperately wrong with her connection. Tech demons or whatever you want to call it. Be gone, tech demons! The name of light or whatever you want to call it. So guys, thank you for joining us. Let's see if Manita can join shortly. If not, then I'll end this broadcast and we'll pick up some other time. We definitely have some other ones planned, and hopefully I've answered some questions and you get some information out of this. You want to check me for my accuracy because sometimes I forget references and stuff like this, but that's okay. That's what being live is about. And remember, even Anthony, when he gets his information from SOC, he's learning it for the first time. And he has to go back because he's like drained, he's like dog tired drained when he's writing these books out because he's just taking notes for days, not even bathing or showering at times. So it's important for us to revisit them information, and if we're wrong, we just kind of have to clarify whatever we got. So yeah, the astrazole question, I really talk to your provider, and you have to maybe talk to your practitioner about this because it's hard to give this information and not bring the ire of other people. So I would really recommend considering a practitioner about that. Okay. All right, guys. I guess she can't join, but again, thank you for joining us. Hopefully, we'll have more fun later on, and we'll talk to you later. So, spiritual high five, and have a good Labor Day holiday.